I'm seeing everything. Whole families of people where mom, grandmom, kids, everyone's positive. Police officers coming, needing to get tested that can't get tests at work. There's a huge need for us here. We are at one of the harder hit zip codes in Philadelphia where there are more African Americans with coronavirus disease and death. Think about how to use your skills and your talents to impact a community, and that's what we did. Once we decided we were going to do it, it took 48 hours to get out in the street and test people. All right, good morning. I'm the surgeon and director. I want them all to watch my technique, so who wants to go first? It was reported that more African Americans were dying than other groups in the city. But the tests are not in our community, and they're not easily accessible. There were so many barriers, and in seeing that, there was no way to really reduce the incidence of disease and death without testing people. And once I saw the city was not doing that broadly, that's how this consortium came to be. So then I just started going down the list. Okay, I have some testing kits in my office. My colleagues have testing kits. So I drove around the neighborhood and picked them up. And then we had a Zoom call with 30 healthcare professionals just to say who's available, who's comfortable testing, who's not comfortable testing. I reached back out to the city and I said, I need the zip codes where the majority of people are being diagnosed and dying. And then I reached out to my pastor and said, could you identify a church in each one of these zip codes where we could use the parking lot? We went from doing 10 to 20 tests a day to 350, almost 400. Today, we'll probably do 250 to 300, but that's only because we don't have any more testing kits. Come on, we're gonna do it together.
Okay, deep breath, deep breath, deep breath, deep breath, deep breath.
Oh, that's it. You're done, you're done. After folks are tested, they can be treated, they can be isolated, they can reach out to all the people they've been in contact with and quarantine. We don't want this to just be a Band-Aid. We want to help them establish care with some providers that will care about and be empathetic to their cause. The whole health disparity, a portion of it is who is providing your care. Is it someone who is empathetic to you? It is someone who knows your struggle. And oftentimes it is people of color, doctors of color, taking care of people of color. The only limiting factor we have is supplies, and it's great that the students are volunteering, but eventually they're gonna have to get back to their work. So financial support from the city, from the state, from the federal government would go a long way, but I don't have any of that now. There needs to be an office whose responsibility is not just when there's a crisis, but every day to handle something like this.